We're going to be convening now to talk about how do we finance at scale for all of the problems, the challenges, and the aspirations that we've heard about. And we've had some really excellent presentations by three great health economists that remind us of very important things. And last night we heard a lot about the moral case, and I think we called it a moral justice. 535,000 children poisoned every year by lead poisoning that we know of. Those children are less likely to be able to read when they get to the third grade and have a 700% higher likelihood of dropping out of school. All of that has an economic as well as moral impact on our society, because the children who drop out of school from lead poisoning, who are more likely to become involved in the juvenile justice system, are also less likely to earn competitively with their peers. We know and talked about the fact that it's a $12.5 billion price tag just to address in a complete form the 1.25 million homes with the highest lead hazards and the lowest income children. But Secretary Castro told us today that challenge is really 4 million households to get to the tip of the iceberg. But the good news, as we've heard repetitively, and Elise Gould, the wonderful economist who was also quoted by Oscar the Grouch in the John Oliver HBO special, if you saw it, that for every dollar invested in lead poisoning, we have a minimum of a $17 to 1 return, upwards of $221 million. And if it falls somewhere in between there, it's probably one of the best business cases that we can put forth. And we have the opportunity to obviously stabilize neighborhoods, lower housing code enforcement, and to have a better and flourishing set of communities. So every year we're spending $50 billion in public dollars for children who are in special education, who have the health costs, who have the challenges of reading, who have the declined earnings. So we've put forth to this really illustrious panel, we need help. None of the folks you're going to hear from, except for one, is really taking on the issues of lead poisoning on a daily basis. But we wanted to bring together really bright minds thinking creatively, helping us think at scale. So we're pleased to welcome to the podium here Andrea Phillips, who is the founder and managing partner of Maycomb Capital in New York City. Andy will serve as moderator and lead the panel. Joining her is Bart Harvey, who is the chair of the Calvert Foundation and serves on the board of the Fannie Mae organization. Bart is also the former president and CEO of the Enterprise Foundation. Joining Andy and Bart is Mark Kim, the Chief Financial Officer of DC Water, Christina Shapiro, Vice President of the Urban Investment Group at Goldman Sachs, and Dr. Nicole Lurie, the Assistant Secretary of the U.S. Department of Health and Human Services, and we'll let them tell you more about their experience and look forward to an engaged discussion. Thank you.
Thank you so much, Ruth Ann, and I also want to thank the steering committee and the folks who've been working to organize this conference for inviting me and giving me the opportunity to moderate this really outstanding panel of folks who I consider friends and some of the smartest people I know. So this is really an honor. So as Ruth Ann said, the goal of this panel is to really spark discussion and ideas. It's a little bit different for typical conference panel where people have expertise directly related to the issue at hand. Instead, what we've done is take a little bit of a different approach, which is to say, let's look at 3 models for innovative finance. Have 3 of our presenters talk about those models. So we have Mark Kim and Christina and Dr. Lurie, who are really going to talk about models for financing. Then what we're going to do is have Bart, Harvey on my left really take what they've said and begin our discussion of how those models for financing could be applied to the lead poisoning issue. I want to go back before I sort of hand it over to my panelists first and sort of put a little finer point on what do we mean by innovative finance. We're at an interesting moment in time, I would argue, where for investors, there's really a growing interest in what is broadly being called impact investing. Really what that means is aligning their investment dollars with their social values. I'm old enough to remember back to efforts when I was in college to get our university to divest from South Africa. That is the sort of grandmother or grandfather of this movement that has really evolved, I would say, in the last, a lot of years that I don't want to admit to, 30 plus, into a growing interest in sort of using investment dollars to drive social impact. So what that says is there are investor dollars out there that can be brought to bear on social challenges. What that means is the roots are really in community development, which is really Bart's area of expertise, about using investor dollars to transform communities. But what you'll hear from Mark and Christina is how you can, again, use private capital to address things like human service needs or green infrastructure. So I think it's a really exciting opportunity for us to, again, begin this dialogue. So I'm going to first turn it over to Mark Kim to start off the conversation, to talk a little bit about a project he just did at DC Water. Mark?
Well, thank you, Andy, and thank you for the invitation to join the panel. DC Water recently issued the nation's first environmental impact bond, and this was a $25 million bond issue used to finance the first green infrastructure project that DC Water will be doing. The reason why DC Water is building green infrastructure is to address a water quality issue. Now, regardless of whether or not you believe in the science behind climate change, the reality on the front lines here in DC is that the severity and the intensity of the wet weather events that we're experiencing today is overwhelming the infrastructure that was built over a century ago. And what happens when you have a rain event and it overwhelms our combined sewer system like we have in DC is that on an annual basis, approximately 2 billion gallons of untreated raw sewage and stormwater are diverted into our waterways, the Potomac, Anacostia rivers, and the Rock Creek. Green infrastructure is a novel solution that we are implementing to address this water quality issue. And I know we're a little bit afield from lead, but just for the context of describing this project, for which I think there are parallels to potentially addressing the financing for lead remediation, is that green infrastructure acts essentially like a sponge. And so it absorbs the initial surge of stormwater before it hits our combined system, and then it lets it dissipate slowly. So our system can handle an enormous amount of stormwater, just not all at once. And so green infrastructure is a potentially very impactful and important solution. However, there's significant risks associated with it, which is why we did this financing. There are three in particular. One, DC Water has never designed or built green infrastructure before. Two, green infrastructure has never been constructed on a large scale in the District of Columbia before. And three, and most importantly, the performance of green infrastructure is dependent on the local climatic conditions. So in other words, the same green roof here in DC won't work the same in the arid weather of Arizona or the very wet climate of Seattle. So the performance of green infrastructure depends on the local climatic conditions. We've never done it, and it's never been done here before. So it was in light of those risks that we were trying to mitigate with our environmental impact bond. And how we did that was to structure a financing where the total rate of return on the bond depends on the effectiveness of green infrastructure in managing stormwater runoff. So what we've done with this financing is to tie financial return to our investors, of which 2 are sitting with me on the stage, but to tie the financial return to our investors to the environmental outcomes that are achieved from the project. And it's that tying together that I think may be a relevant possible solution for some of the lead remediation efforts that I think are underway. So maybe I'll stop there and then we can circle back.
Great. Thank you, Mark. I'm now going to hand it over to Christina to talk a little bit about the work that Goldman Sachs has done with social impact bonds, which are in fact not bonds. That's another conversation, and energy efficiency financing.
Thanks, Andy. Well, I think you covered at least the first fallacy, which is that it's not a bond, it's a loan. I want to talk, as Andy said, about 2 different types of financing that hopefully could be models that the National Lead Summit could learn from and use as ways to move ahead on this issue. So the first one, as Andy said, is social impact bonds, or I'm going to call it social impact loans. And what these are ways where private investors can expand proven social interventions, and they are repaid through the proceeds of a pay-for-success contract with a government entity. So the way that it works is Goldman would come in to help expand, and I'll give you a tangible example, like we did in Utah, a high-quality preschool program for low-income youth. And the reason we decided to do this is because there is a lot of research that talks about the benefits of high-quality preschool for children. And in Utah in particular, in the Granite School District, there were at least 600 children every year that were on a waiting list and were not able to get into the classroom because there weren't enough sources from the local government, from the state government, to fund those slots. So we put up the money, $4.6 million in partnership with another investor, to get those kids into the classroom. The way that we get repaid is if children who were deemed high risk for non-performance once they got to kindergarten were in fact performing, meaning they no longer needed remedial special education. And so for every child that had gone through the preschool program that was deemed high risk, that would no longer need special education in kindergarten through 6th grade, it would trigger a payment to Goldman Sachs. So we were taking complete risk to the scaling up and implementation of this innovative preschool program. And in this case, the issue and the problem it addressed is that the government did not either have the resources to pay for these slots or wanted to move towards more of a pay for performance. So instead of just paying for the slots, would only pay in the case where those children achieved a desired outcome. And it was a sharing of the risk between the government and the private investors. And as Mark said, as much as you can take a program that has, nobody can argue with the merits of high quality preschool, but taking even a program that has had very strong historic performance and scaling it brings with it implementation risks. And that's where the role of Goldman in taking on that risk was incredibly valuable for, at first, the Utah County and then Utah State. Let me move on quickly to energy efficiency financing, and then we could come back to it later. But I think it's a different model where we're able to pay for the cost of installation of energy measurement, energy conservation measures, where we'll be repaid by the savings that result from energy conservation in the future. And one example of that is where we were able to finance the Newark Housing Agency, and Goldman provided financing to purchase the equipment and install energy efficient capital improvements in over 6,000 units of public housing that are administered by the Newark Housing Agency. And in this particular case, what we were able to do is monetize HUD's budget. So HUD provides financing to the housing agencies, and in this way, the Newark Housing Agency was able to make these improvements to the homes without having to lay out the capital up front. That was provided by Goldman. At the initial phases, some of the funding to pay the debt service was covered by HUD, but over time, the savings cover all of Goldman's debt service. Once we're repaid, HUD and the housing agencies are able to benefit from the savings for the remainder of the year. So again, that's another example where we were able to use our private capital to bring forth important capital improvements, and thinking that this might also be an interesting way to think about how do we use a similar structure for lead abatement and remediation. So let me stop there.
Great, thank you. Moving on to Dr. Lurie, can you talk a little bit about your experience with in Flint and sort of how the funding there worked?
Sure. So let me also thank the organizers of this conference for continuing to call attention to such an important issue, and thank you for the invitation to be here. As you heard, I'm the Assistant Secretary for Preparedness and Response at HHS, and since January 16th, have been the lead federal official for helping the federal government deal with the Flint water crisis. I just want to make a personal comment that for me, one of the very special things about being able to take on this assignment is that 45 years ago, now hear that, 45 years ago, as a wayward high school student, I spent my last 2 years tromping around inner city Hartford, Connecticut, collecting paint chips and drawing blood from kids on their kitchen table because lead poisoning was such a public health hazard. Never in my lifetime did I imagine or appreciate the way this problem was still with us today. Yes, things are better, but it's really time that we get lead out of the lives of kids. So having said that, and thinking about the investment framework for this, our approach at HHS, I think, has been to take an approach to this problem that frankly gets us returns on the investments we in HHS make at very different time frames. So if we got to Flint, we saw the issues at hand, we identified 4 major goals for our response, not surprisingly, make sure, people had safe water to drink, fix the infrastructure, understand the size and scope of the problem enough to do something about it, and then do the kinds of things that we could do to mitigate the effects of lead on kids. The very short-term, immediate things that get you a return on investment are being sure that people have safe water. But if I think about much of the rest of our approach, we very much took a social determinants approach to this problem and put in place a series of interventions, some of which will get us very short-term returns, but most of this will get us returns, as you've heard, that 17-to-1 return comes over about a 17-year period, comes over the childhood and young adult lifespan. When you think about the policies that need to be in place in a federal government to support that long-term investment, it's very different than it is in private capital. The federal government and Congress scores things and budgets and scores a year-to-year return. The people who are in place to decide to make those investments aren't the people who get credit or reap those returns. And so this public-private partnership between private investors and the federal government becomes terribly important as we think about a series of investments that we make. So let me talk about a series of investments that we make and that we need to make. One is an ongoing investment in lead surveillance, because we hear how many kids are impacted, but Medicaid on a good day is screening about 60% of kids. We're not going to solve this problem unless we can identify kids who are impacted. In Flint, when we took a social determinants approach, we thought about, well, what are the kinds of things that are going to be important to mitigate the effects of lead on kids? And, want to call out Dr. Mona somewhere in the back of the room, who helped us with so many of these things. But good nutrition, getting in place good nutrition. This is a here and now investment in a place where kids don't have access to good nutrition, that's a food desert, and all of those things. Within the federal government, we've been able to identify money for 1 or 2 years, but if you stop that investment now, you will not be able to reap the returns to children down the road. So we've made an initial investment. We need to think about how to sustain those investments so that we reap the returns. Same with early education. We were able to expand Head Start slots and work with the state of Michigan to really expand early childhood education. That work needs to be sustained, as you just heard from the investment side of things. I believe that those will reap the kinds of investments we're talking about, but over a much longer term. Within HHS, we did a number of things. In the very immediate, what are we going to do about our return on investment? This month, this year, we put money into the community clinics. We put money into mental health. And in a very exciting, historic thing that we did, we expanded Medicaid to cover all kids in Flint who have been exposed to the Flint water system up to 400% of the federal poverty limit. That's an investment that's now there for 5 years and will provide kids access to care, to developmental assessments, to the case management they need. That's a good down payment on the investment that kids are going to need to be healthy. But again, it's a down payment that's going to need to be followed up with subsequent investments. And then finally, I know the thing that people are excited about, but I will say is just a down payment at this point, has been the flexibility within CMS and with Medicaid to use money in the CHIP Health Services Initiative to be able to fund some of the infrastructure work to get the lead out of homes. That's got, not surprisingly, a lot of conditions attached to it, a lot of guardrails attached to it that include being sure that you're doing this in a population where there's a substantial population impacted by lead to start with. And that if you're going to do it, you really need to get all the sources of lead out of the kid's home. So ideally there, the lead service lines get replaced by the city or by other funding. And then if there's lead in individual housing, that this money can come behind and help get the lead out of that individual housing, particularly the water fixtures and others of kids who have high levels in those houses. So again, it's a partnership of weaving together different kinds of funding to accomplish this goal. Some of these things will yield very short-term returns, and again, as Dr. Mona will tell you from seeing these kids, just getting the lead out of their system is going to be a good start. But in terms of dealing with the long-term impacts, we are talking about investments that are going to reap returns over many different parts of the life course, and it's why I think the public and private partnership models of doing these investments is so important. So why don't I stop there and answer questions as people have them.
Great, thank you so much. And a very helpful framing about that sort of immediate response where sort of direct government funding makes so much sense in your ability to move quickly, hopefully, ideally. But then sort of how do you think about this in the longer term? And really, I think you highlight the theme of this panel, which is really about public-private partnership. And so with that, I'm going to turn it over to Bart Harvey and sort of say to you, based on your experience, what ideas here resonate in terms of creative strategies that you've either seen in affordable housing or economic development projects that could be sort of applied to the lead poisoning case?
Yeah, well, Andy, a lot of them do. And first, I commend everybody here for what you are looking at, which is solving the problem. And something that is bold and ambitious, and that incorporates elements of what you've heard today on its financing, is the way that you ought to move forward. Also, what I heard was that public health should not be in opposition to housing, but it ought to be part of housing, and that you ought to find ways that this is affordable. And I'm going to use an analogy. So when Enterprise in 2000 decided that sustainable and affordable wasn't an oxymoron, that we've gotten to the point where you could be sustainable and in fact it could be affordable, we went to the environmental field, to NRDC and the U.S. Green Building Conference, which didn't have a sustainable code for affordable housing. And then we got 10 other partners in line and did all of the trade-offs that you needed of what cost more but was still sustainable. What would get everyone on the same page so that you had a unified voice going forward? The second part, we said, where are the leverage points, particularly in the affordability, and that was in integrative design. And so we brought foundations in, because that's the smallest piece, that's the planning piece, but the most critical piece on how are people going to do what we call green communities. The third thing we brought in was size. It said it's got to be $500 million. If you're talking about scale, that's the beginning. And so we looked at $500 million. We got financing from banks lined up that would give concessionary financing if we could achieve the criteria that was set forth by the environmentalists and by the housers. And then finally, what are your state leverage points? And in this case, it was the low-income housing tax credit, 3 times oversubscribed. We went out to 20 different states which adopted our criteria and made it a point, positive points in a very competitive scoring round. And before you knew it, everyone had to adopt this criteria in order to get the low-income housing tax credits. And at the same time, we were working for more of them to come in. And the $500 million since the launch in 2004 is $6-7 billion. So the analogy works here in saying you ought to have in your mind the same kind of thinking and leverage points, and you've got to start that pilot program, and it's got to be national. It may start in states that are more enlightened than others, and you could use a pay-for-success bond structure of some size, and it would be interesting if you could get, if it's Dr. Ben Carson has been rumored, who is coming in to do HUD. He's a pediatric neurosurgeon. He knows what lead is. And pay for success sounds Trumpian to you, doesn't it? But I'm being serious here. Find things, you got to have a simple, long-term vision. This is a very complicated, very tough to do issue in the country. But if you can say, we could get 5 states to start with $1 billion to solve everything in those states, and you could get, I'm sure you could get foundations that would put up money for the design phase of it. Andy says she could get private investors to take on the risk of non-performance in it, which is a pay for success. And you could go at it, and you have to be accountable for it. The other thing that you've heard from this administration is it's all about jobs. It's all about jobs all over the country, in rural areas and other areas across the way. So if you take a state and you calculate not only the benefits, long-term benefits, they get dismissed more easily, but the jobs that you're going to create, and you work, if Carson can work with HHS, I'm not sure that's going to be possible, or other parts of this new government coming in, where you're touching pieces of health, and you're touching the EPA, you're touching different silos of the government, but you're doing it holistically, and make it a broad stroke, and make it a big vision. You've done the work. I mean, the work is amazing. I look at Ruth Ann and David Jacobs. I look at David's primer. He's got it there for you. You know, American made, American training, doing something that really helps children along the way. Ruth Ann has the same thing in her green and healthy housing initiatives. You know these issues. You know it's much harder than you present it, which you've got to present it as something that can be done, will be done. You'll have people accountable for it. You're going to use finance structures that are new and hopefully exciting to the government, and that depend on whether it's both jobs and removal of lead, which is the most important thing that you can do. And think that way. Just think differently, larger, and then you find those leverage points in this administration to help with this. And that's what I give you.
Thank you. I think that's a bold vision and sort of laying down the gauntlet, which is, I think, in a sense, what we need. I think one of the things that's interesting that you threw out there, and it's something that folks in the world of pay for success and social impact bonds talk a lot about, is what we would refer to as, and I think actually Sean Donovan, former HUD secretary, coined this phrase, the wrong pockets problem. And what we all, having spent a lot of time working with government, what we all end up with is, and I think the lead issue is key, which is lead abatement ends up being a real estate and a housing problem. But in fact, the costs and the benefits sit over in healthcare, as well as education and criminal justice. And the question is whether by doing something as bold as Bart has laid out, can you sort of grab hold of all of those benefits together as a way of really financing the improvement? Because again, with the wrong pockets problem, if you just focus on the housing piece of it, you'll really never get there. So really, I thank you for that. But I do want to look at the little bit of the other side of that. So you threw out $500 million, and then by the end of your remarks, you were up at $1 billion.
No, we were $500 million in our start.
But you needed $1 billion, so you're putting us at $1 billion. So
just inflation.
Thanks. So Mark, when you talked about the environmental impact bond, it is $25 million. Christina, I know because we used to work together that the deals you're talking about are
4 to 30.
4 and 30, so they're also small. I'd love it if both of you talked a little bit about both the promise and the challenge of getting to scale when you're talking about innovative finance.
Sure. So I think the promise is, as Bart and Andy laid out, is you're bringing different investors with different interests together to help resolve these very complicated social issues. And I think the promise of a social impact loan structure is that you're bringing a lot of capital to solve issues, and you are, instead of government being in a position where they have to either pay it up front or pay it on a reimbursement basis, they actually get to pay only if certain outcomes are achieved. And so that allows the government to allocate more dollars in the future once the initiative has proven that it's successful, or allow them potentially to evolve from more of a social impact loan to potentially a true bond issuance, where there could be a rating and guaranteed payment, or maybe something like DC Water, where there's guaranteed coupon payment, but then there's variability in terms of the interest. So I think there's a lot of promise there. And when I think about what it would take for a social impact loan to work in the lead issue, I think that to the extent that jurisdictions across the country, or even within a state, could look at a similar structure. I think part of what's kept some of the deals smaller, and Andy can speak to this as well, is that each deal is completely different and bespoke. And to the extent that all of the jurisdictions that are trying to address the lead issue can think about a similar structure, benefiting from potentially similar grants. I'm not an expert, obviously, in this, but read that there's about 58 different federal initiatives supporting lead abatement and remediation, a lot of different sources. To the extent that those jurisdictions can think about a similar term, similar outcomes, and clearly the benefits of lead abatement and remediation, and ending up with a completely lead-free homes, soil, water systems, it will take years to see the benefits. To the extent that those jurisdictions can also think about, are there earlier outcomes that can be monetized? So investors who may not have the ability to think about a 17-year term or a 25-year term for a loan could potentially get repaid, then you start to think about something coming together, right? And if you're able to put multiple investors in a stack, right? So it's not, there's Goldman, but almost every deal that we've done has Goldman along with either other banks and or other foundations, with different investors having a different risk tolerance. And there could be an ability for earlier outcomes to repay the senior investor who might have a tolerance for a shorter term, and then foundations or other types of institutional or private investors who have a tolerance for waiting longer, being able to get repaid second, and seeing that program live throughout its fruition, where you're able to measure the outcomes of those children being lead-free through their kindergarten, being tested for 3rd grade, being on track, hopefully, and then ultimately staying out of the criminal justice system. So I think that to me is inspiring, and I can see a future where that works. I think as the inverse of that are the challenges, right? It has to be simple. I think no investor is going to want to look at 52 different investments, each $5 million, that are getting repaid by a different agency at a different term. It just makes it too hard to manage, and unfortunately will not be scalable. So let me stop there and hand it off to Mark.
Sure, I would add with DC Water's environmental impact bond, it is a very scalable and replicable solution. I think the reason why a lot of social impact bonds and why our environmental impact bond was on a smaller size has to do with the question of risk. And I think that's a key aspect that if there's a takeaway or a parallel for the lead conversation we're having is to understand what are the risks that are involved. Because once you can understand the risks of remediation or abatement or new technologies to achieve those goals, once you understand what those risks are, then you can quantify them. And once you quantify them, you can price them. And if you price them, you can sell them. And that's what we were trying to do, and that's what we did with our environmental impact bond. There were a number of risks that I talked about with respect to green infrastructure as an unproven and untested technology on a large scale here in DC. We looked across that spectrum of risks, design, construction, maintenance, and we decided that DC Water was actually best positioned to bear those risks, design, construction, maintenance. The one risk that we were not comfortable bearing was performance risk. What if we do everything right, we design it right, we put it in the ground right, we maintain it, but it doesn't work? That's the risk that we were seeking to hedge with our environmental impact bond. And that's the risk that we isolated, we priced, and then we sold it to our investors. So I think this pay for success strategy would maybe be very applicable to the leads conversation if there's maybe unproven, untested methods, maybe it's being done on a scale that hasn't been done before, and that there's a risk that makes sense to try to price and offload in the capital markets relative to risks that the community itself might be better off bearing itself.
So let me throw a kind of a crazy idea out there, and this is not sort of an endorsement of a U.S. government position, but I'll say my office has a lot of other responsibilities. Among them are the development of what are called medical countermeasures, vaccines and medicines and other things for biological threats, terrorist threats, other kinds of things. And we do this advanced development work in a space where there's no market, but it's largely about new technologies, innovative technologies, and others. We find very often when we make these initial investments that we are able, or the companies who do this are able to leverage an awful lot of private capital. In this case, some of, especially the technological innovation, really has a market. And so you don't have to worry about the federal government buying it in a stockpile. But it does make me, putting it in a stockpile, but it does make me wonder about whether there are ways to leverage some very early, pretty modest federal investments to get some of this started, to buy down this risk, to leverage the other capital, and then talking about the 50 other programs and the gazillion cities around the country that then need to apply some of these new technologies and these risk mitigation pieces. Whether public-private partnership models outside of the space that I'm discussing could be applied to a program or a product like this in a really novel way, and I think it may be worth exploring.
Could I just follow up on that? And I think that's a great point. And this question of risk and an innovative solution, we were confronting it at DC Water, and the question was, what is the incentive for a public sector agency to take on the risk of a novel solution that hasn't been proven relative to a solution that we know works, which is gray infrastructure. So we were taking a risk on green infrastructure. The gray infrastructure solution to the water quality problem I described is 100% certain. Its cost is certain. Its effectiveness is certain. And so the question was, what incentives are there for someone like DC Water to take on the risk of an unproven technology? And the answer is there isn't a whole lot of incentive to do that unless you can find a way to offload or to hedge some of that risk. And I think that's exactly what we're talking about in the intersection of private capital and how that can help to de-risk an innovative solution.
But the short-term returns here are the jobs, right?
Absolutely.
Longer-term returns are fixing lead.
And that's what I was gonna comment on. There are shorter, you want shorter and longer term, you want things done right. It's gotta be done at the local level to be done right, I think in this case. But there are accountable measures that you can put in. And sort of my thinking would be infrastructure is gonna be one of the big things that this administration says it wants to come forward with, paid by getting offshore money back on a lower tax basis. But part of that, you ought to be part of that. I mean, there ought to be $1 billion or more that is part of that, and you can say it's a different kind of pay for success, that it goes to states that have looked at the accountability and the jobs that they're going to create out of this over time, and it's not repaid if they have success, and you will, or you will match private investors who will be working with you on this kind of thing. So I would say everything here makes sense. Just raise the zeros on it and see if you can do it. You have nothing to lose in this for having the vision of what you need to solve the issue. It is crazy that we are still have this issue costing not only human potential, but billions of dollars in all of these other pockets. And we ought to be shooting for getting an answer to this, or getting the size and proportionality of that answer. And if you don't get it, you don't get it. You still work at the local level, you still adopt whatever you can along the way. But if you don't try, you won't get it. Everyone told me at Enterprise I was crazy, that we'd never get it done, and it took off. And that was thanks not to us, but all the people that had been doing the work on sustainable and affordability all across the country. And I mean, there was, so anyway, this is, all of you have been doing this work all across the country. And you ought to have the resources you need to complete this. So anyway, it's easy for me to say you're going to have to figure it out. But you got the pieces, you got plans, you pulled it together, you know what works. I don't know, Ruth Ann in Maryland, it's 90-some% improvement over time. I mean, it's 98%. That's amazing. It ought to be 100, but that's an incredible thing that has occurred through really hard work of the groups that have worked on it. And David, Ruth Ann, and others have been working on that, and they've gotten to 98%. So anyway, I'm sorry.
No,
I
I think
soapbox, but anyway, I just think that way. Try and get there.
so. I think it's great that you're encouraging everybody to think big, and I think as I try and make sense of this, and I'm sure all of you here are as well, I think what I hear is, my takeaway is from Christina and Mark, that it's the building blocks, and if you can find powerful local or state actors and knit them together, that's where we begin to get to the scale I think that Bart is talking about, as well as I think it's really interesting, this notion again of when you think about layered capital structures, how does the federal government come into that as part of that risk capital, that it should be willing to take the biggest risks? I want to pivot now and address some of the questions from the audience, which seem to be a little bit more detailed. So we'll circle back to our big vision, and you'll have another chance to goad everybody on before the end. So some specific questions around social impact bonds. So if there was a social impact bond designed to abate lead hazards, who would be the payer? And that's for Christina.
I will take that, and feel free to jump in, but clearly, I mean, if we're talking about the ultimate cost for non-remediation, non-abatement, it ends up being, as you said, Andy, education and health. And so presumably what we've seen, and it doesn't have to be this way, is the entities that are most likely to be the payors are those who bear the burden of not addressing the issue. Because they're going to end up covering a much larger cost over time than if they invest in partnership with private sector investors or others up front. That being said, it doesn't have to be the case. In Utah, because state legislation didn't pass as we were getting ready to launch the social impact bond the first time or loan, the county basically raised their hand and said, you know what, we understand that this can work, we're going to give it time for the legislative process to make its way through. We'll fund the first cohort of children, even though the county is not the direct beneficiary of reduced or avoided special education costs. That, in a sense, enabled us to launch a proof of concept year that then led to the state passing the legislation and funding cohort 2 through 5. Do we think that's a scalable way where you don't necessarily always have the beneficiaries not involved? Not necessarily, but I think it often is the way to get something off the ground.
So what I would
others have
add
thoughts.
to that in terms of sort of who is the potential payer, you also have to look to the healthcare system, right? Who clearly bear a lot of the costs of lead poisoning. And so there have been some cases, most notably in Maryland, where Ruth Ann's team really led this effort around looking at health insurers as that potential outcome payer. The underlying funds more than likely are Medicaid anyway, but taking it one step removed from government. So just to add that. Another question about jurisdictions interested in exploring social impact bonds or loans, how should they get started? I'm going to punt that one to Mark, because I think you sort of, while you put environmental impact bond on it, you really lived through and drove this process.
Sure.
At DC Water.
Well, we've had an incredible number of inbound inquiries, both from the impact investing community as well as from other water utilities and state and local governments around the country that are responsible for water quality in terms of what we did, how we did it, and why we did it. So I think we are also working with the EPA to create kind of like a knowledge base for state revolving funds as well as water utilities to access the structure and the mechanics behind what we did. We've tried to be very transparent and put forth kind of our own best practices. So even though this was a privately placed transaction and not publicly offered, we've fully disclosed everything, all of the terms and conditions of our deal and how we got there, as well as all of the quantitative modeling that went into determining performance of green infrastructure. So I think there's a real groundswell of effort in the industry to try to put forth best practices on what's been done.
That's
Can
great.
I add something? I mean, there's been a lot of grant resources put out into the market to help either local jurisdictions or providers who think that they're ready, they have the data and they think that they're ready to scale, think about how to use a pay for success or pay for performance structure. And so there's now a growing number of intermediaries who are helping either the government or the providers put together a PFS project. And so some of them are social finance, third sector capital partners, the nonprofit finance fund, and I'm sure I'm forgetting others, but there are more resources, and what I suspect is because there's been so much TA and TA funding that's been available in the last few years, that my hope is that we'll see a growing number and a new slew of pay for success projects launching in the coming years.
Great, thank you. Now we're going to shift gears a little bit away from social impact bonds, and so a question for Dr. Lurie. And my eyes are failing me. As the CDC level of concern continues to be lowered, it appears that interim
Up top.
It appears that interim controls will be phased out as a remediation option favoring full lead hazard abatement. Will this result in fewer homes being addressed with limited funds?
So I think that what the questioners are asking about is the fact that we are being successful at getting lead out of the environment in a lot of different places. And so where CDC is setting that threshold for what's 97.5% of the population is continuing to be lowered. You know, I think at this point, again, this whole construct of ROI becomes really important, because I'm not sure that there's any particular abatement option right now that is off the table, but that you need to look at the array of abatement options that are out there. And frankly, I think ultimately model, again, where you are going to have the highest impact, hopefully on kids as opposed to homes as your denominator there. So I'm not sure I would take anything off the table yet. And I think, frankly, if there's real investor interest, we'll also probably have new technology that can help accelerate lead removal from the environment in general. So I don't think I would come to any conclusions, but I would want to go about the next generation of abatement in a really clear-eyed, science-based, investment-based way that gets us the greatest return in first and child health.
Which really also in some ways speaks to the prior question, which is where do you start thinking about it? And where it makes sense to start thinking about it, and often jurisdictions think about this, is doing some real analysis of what do we know about the problem, what do we know about who it's affecting, and what do we know about the set of solutions that are out there that provide the highest ROI, right? And what we know is that's not always going to be the most expensive. And so it's really doing that analysis, as Dr. Lurie points out. Thank you. So now I want to pivot back to Bart and talk a little bit about investors. So you were able at Enterprise to raise $500,000. Can you talk a little bit more about who those investors were and what interested them about being part of this effort as, again, a learning for what could happen in lead?
Sure. The smallest piece of it, but the most critical, as I said, were foundations who were very interested that the housing and environmental world had come together, and they provided about $50 million in grants to help people do their integrative design work, and we gave those out as grants. And then the major financial banks were very interested in financing green. This is old news today, but this was back in 2004, and so they came on board with a certain amount of concessionary financing. The key thing, of course, for affordability is where does the government come into it, and that's the public-private partnership, and that was through the low-income housing tax credits for anything that was rental house, affordable rental housing. And by getting the states, and there was a big market for low-income housing tax credits that have been proved out. In fact, it was so big that there, as I said, there were 3 times the number of investors for every tax credit that could be allocated. And by getting states to put criteria in for the green communities, criteria in, and saying we are going to do sustainable, affordable housing and getting extra points for it, it meant you would get the allocation of credits. So, and the investors were waiting for that, and that was the key rung for the financing that went on top of it, and that made the whole pile work. So somewhere in this, you need the same thing. I mean, the government has to play a role in here, because the costs of keeping the most critical homes where most of the poisoning is going on, for which is really poor people, still affordable. You need to have that grant money, or you're going to have the chance of being homeless and a lead-free house instead of that family intact in a place without lead. So you have to have the government's intervention in it, or grant intervention, and there just isn't enough foundation money to go around for this.
Dr. Lurie?
No, I'm going to need to take off in about 1 minute, so that's all.
So I think there is a final question for you, and this is a broader question and a little bit provocative. So will HHS provide the same services, and I'm not sure you can answer this, to all lead-poisoned children that HHS has provided in Flint?
I don't know that I can answer that question, but I guess what I would say is Flint was a really unique circumstance, as I think you all know, of a whole population that was exposed to higher levels of lead because of a lot of malfeasance in one way or another. And it was also a situation where communities' concerns were disregarded for a pretty long time. What I've seen since then is communities have started to recognize their lead problems, is the governments have gotten on those pretty fast. Nobody, hopefully, will let another Flint happen in that kind of way. So as I indicated in my more prepared remarks, we've been able to identify 1 or 2 year money, and in the case of the Medicaid expansion, some 5-year funds, and mental health funds, some 5-year funds, to begin to address the problem. I think whether HHS or other parts of government decide to continue those kinds of funding depends a lot on the size and scope of the problem, how well those things work, all of those other things. But recognizing that lead is a widespread national problem, it probably needs a much more widespread, nationally sustainable solution than what we were able to do in Flint. So I'll just stop there.
Great.
Thank
Well,
you.
thank you. So thank you so much for joining us. And probably, the polls are up, and I've been asked to encourage all of you to do the polls, which I don't know how to do, but I'm hoping most of you do. In terms of a final wrap-up, any final comments from the panel?
My sense is definitely what Bart said, but keep it simple. If the goal here is to leverage private capital, I think there were some questions that we didn't get to answer, but like, why are some investors not jumping into this space as much as we would like to? I think investors need to understand and be able to measure the risk so that they can price the risk. And so often, if you are the experts in the space, and your ability to be able to quantify that risk and then be able to measure that will enable more investors to come in and determine what role they want to play. So I would say, again, don't make perfect the enemy of the good, and don't try and solve everything and design a perfect solution that will address every single issue. If you want to launch something in the pay for success space, I would say start simple.
Great. I would want to draw a distinction between funding and financing. And I think that funding is how you're going to pay for something. And financing is how you might leverage the source of funding you have to do more with less. So if you don't have the money to pay, or the funds to pay for the program, you don't get to the question of how can we leverage it. You can't leverage something you don't have, and you don't get to the financing question. And so I think it's important to know that, and I would agree with Dr. Lurie that lead is a challenging problem because it's a local problem, but it requires a national solution. And you get into misalignment and jurisdictional issues, and the federal government plays a role, and it makes it a very complex problem to solve. But I think to the extent that there are risks involved in the remediation efforts or the abatement efforts, I think capital markets can play a role in hedging that risk, and I think capital markets can play a role in helping communities leverage private capital to help take some of that risk.
And I would just say, I think you need incentives in this in the end. And you also need a certain amount of competition for states to take on something, see that it works, and challenge other states to solve their issues as well. But without those incentives, without those larger incentives, it's going to be very hard. You're going to be working at the edges of this. The federal incentives can, again, you can use the capital markets much more efficiently. The low-income housing tax credit is a federal incentive. It's just a way of incenting for affordable rental housing. You need those hooks to get this working across the country in one way or another.
Right. Well, I think we are officially at our time, and I want to thank the wonderful panel, for your comments. I know it has gotten all of my wheels spinning, and I hope it has done the same for you. And I think you've laid out a challenge for us, and I think it's an important one and probably of the right scale if we're going to really actually make a dent in this issue. So thank you very much.